Good morning, everybody. My name is Fitim Raçi. I'm working in the National Institute of Public Health of Kosovo, and I'm MediPIET, a fellow from the second cohort. Today I'll present to you the evaluation of surveillance system for Crimean Congo hemorrhagic fever in Kosovo for period 2013-2015. Crimean Congo hemorrhagic fever is caused by zoonotic virus, which belongs to Bunyaviride family, and it can cause severe outbreaks with high fatality rate, up to 50%. Incubation period is 1 to 3 days, maximum 9 days after tick bite, whether in case of secondary transmission is 5 to 6 days, maximum 30 days. Crimean Congo hemorrhagic fever virus is categorized as high priority bioterrorism agent. So far, 107 settlements within the territory of Kosovo have been identified as endemic areas, mostly in central and southwestern part of Kosovo. Year 2013 was the worst in history of Kosovo, with 26 positive cases and 11 deaths. Surveillance system has been established in 1999, and it's tick bite related and human based. You can see the flowchart in information for Crimean Congo hemorrhagic fever, and according to this chart you can clearly see that every tick bite is obligatory to be reported at the National Institute of Public Health. If any of these cases shows any sign of the disease, then they have immediately to go to report to the clinic for infectious diseases, which is very close to the Institute of Public Health. The objectives of the evaluation of surveillance systems are to identify the gap of the system and provide feedback and recommendation in order to improve the surveillance, to assess the performance and data quality of surveillance system, to identify the resources and training needs in order to use them for self-assessment and self-development. This is a descriptive study in accordance with CDC guidelines for evaluating surveillance systems. To assess the system attribute, we used the Crimean Congo hemorrhagic fever data set for period 2013-2015 and structured questionnaire. Health personnel involved in surveillance was identified and interviewed. Results for scoring qualitative and quantitative indicators were expressed in percentage using Excel file sheet. Since this is the first evaluation of the surveillance system in Kosovo, we have evaluated just few attributes such as data quality and completeness, timeliness, representativeness, simplicity, and acceptability. The map in front of you shows the hyper-endemic zones in Crimean Congo hemorrhagic fever in Kosovo. You can see that most of the zones are in the central and southwest part of Kosovo, but nevertheless, this doesn't mean that the regions around them are not endangered from the disease. During the period 2013-2015, we had almost 13,000 tick bites notified, most of them during the year 2013. We had 32 positive cases, and number of deaths was 11. Incidence was 1.75 per 10,000, and case fatality rate was 34.37%. 66% of all affected positive cases were from municipality of Malisheva. Out of 32 positive cases, 94% live in rural areas, 87% were males, 72% belong to the age group between 19 and 65 years of age, which we consider as capable for work. 56% were farmers, 53% in 53% of cases, the disease was transmitted by ticks. In 76% of the affected have removed the ticks at home, and peak was always in June, even though the prevailing system was during the months of May, June, and July. Data quality and completeness. In order to evaluate this attribute, we used the questionnaires, we used the reporting forms. As you can see, the proportion of data collection forms received versus expected is 100%, which means that every case was reported and has the reporting form with it. Proportional completeness is very high, and it's 80% during 2013, and it increases up to 100% in 2015. Proportion of cases that meet case definition is 100%, which means that all the reports meet the case definition. Proportion of sample cases with available laboratorical data is 100%, which means that all the cases were laboratorically confirmed. A reporting form has a sufficient amount and type of data necessary to meet case definition. Case reporting forms are received and controlled on daily basis. Forms all filled correctly. Overall performance is, as we already said, in the range from 80% up to 100%. It's slightly lower in year 2013, but increases in 2015. What's evident here is that during the year 2014, even though we had very good completeness of the forms, regarding the information of tick risk factors, we have just 80%, which means that this was the problem during this year. In our case, the timeline reflects to the time spent from the first visit to the health facility or healthcare provider after tick bite or onset of symptom until the final laboratory confirmation or death. Tick bites were taken care at the scene and reported daily. Suspected case report as soon as possible to the clinic for infectious diseases in Pristina, and from where the blood samples are being collected and sent for laboratory confirmation. For this issue, we use a real-time PCR. All the specimens got the final results within 24 hours, but the time frame is just 4 hours. So in this case, for example, during the night 2013, the percentage of the cases which had the final result with these 4 hours was 97.5%, and 2015 is 19.2%. Samples received within the 24 hours were expressed in absolute numbers, and you can see that we had more samples received during the 2013, but in the years following, two following years, the number is more or less the same. Simplicity is to measure some indicators of the system. We have conducted the survey among the health professionals, and for this issue, we have developed the structured questionnaire. Respondents were first asked if they report notifiable conditions and if they have these forms in their institutions. 90% of the respondents have categorized the surveillance system as very easy. 84% responded that they regularly report or deliver sample to the National Institute of Public Health, and 71% said that they have not enough time to deal with surveillance activities. Physicians were willing to collaborate, and reporting, by the way, is mandatory by law. Results from our surveys show that the respondents were very satisfied with the following reports or follow-ups, and in this case, so that means that all of them, they get the feedback of what happened with the cases that they have already reported to the National Institute of Public Health or to the Clinic for Infectious Disease. When asked about the time devoted for daily surveillance, 90% of them declared that they need approximately 2 to 3 hours daily for surveillance activities during the season. Based on all what we mentioned, we draw the following conclusion: that Crimean Congo surveillance system in Kosovo is fully functional, and it covers all territory of Kosovo. Data quality and completeness of reporting form is very good. All specimens were analyzed with the final results within 24 hours. Surveillance system is accepted as simple operating procedure. 90% of the respondents have categorized the system as very easy, and timeline is adequate for detecting outbreaks and implementing effective control measures. The recommendations that we draw out from all what he mentioned before are leading us to the identification of the opportunities for further improvements through continuous training and increasing of surveillance staff, raising awareness in rural settings or areas, improvement of reporting risk factors, implementation of electronic reporting system, developing refined maps showing spatial distribution of Crimean-Congo hemorrhagic fever in order to see if we have new cases aside from the endemic photosis, and strengthening further multidisciplinary approach. Thank you very much.
Thank you, Fitim, for this kind presentation. And yours, the turn. Any question, please? No? Oh, okay.
There is no question. I have one question myself. That's about the methodology itself of the surveillance. So I noticed that, in fact, the surveillance was based on the notification of tick bites.
Yes.
And you have reported a huge amount of tick bites.
Yes.
Close to 13,000.
Yes.
And finally, you have detected 32 positive cases.
Yes.
So what do you think about the performance and the efforts which are developed in collecting information on tick bites compared to the number of positive cases you finally received?
Thank you for your question. It's true that during this period we had almost 13,000 of tick bites reported, notified from the regions, mostly coming from these affected areas, as we consider them as hyper-endemic areas. It's the fact that, as you can see here on the flowchart, and we already mentioned that this is tick bite related. So every tick bite has to be reported because it's considered as potential case of Crimean-Congo hemorrhagic fever. Luckily, from all this huge amount of tick bites reported, we got just 32 cases, and most of them during the year 2013, which were we considered as an outbreak of Crimean-Congo hemorrhagic fever. This is the fact, and I mean, this is the number what we got. Luckily, we have just 32 cases in this period. Even though it's still high, because this is the worst, the year 2030 was the worst in the history of Kosovo, with 11 deaths.
Yes, okay, thank you. My point was just about the performance of a system where you make a lot of efforts for collecting information on tick bites, and on the other side, you have very few positives. So the question was about the involvement and the performance.
The point is that we are very aware about the seriousity of the situation. We are aware that we have to deal with a very serious disease with high fatality rate, and that no one is really spared from the disease. And if we start from the fact that more than 52% of the population of Kosovo lives in the affected area, then we need to collect all the data for every tick bites, even though that sometimes is very hard because we don't have the specially trained personnel for these things, but the people who are working in the health institution, primarily in the primary health care system, they deal with these activities, and it's really hard to do this as additional work to the other daily works that they do.
Thank you. Last question.
No, it's not a question. I
okay.
comment about your question, because not all the ticks are infected. The viral
Yeah.
is very few. It's the same thing with rabies. You have to document and record every bite, but not every bite has rabies. That's the same thing.
But every tick bite may be considered as potential case.
So you have to record the bite, but you don't have to be a case.
Okay, thank you very much. We thank you for respecting the time
Thank
and
you.
for your excellent presentation.
Thank you.